fold in our plant, our inside man. Not too loud, right, Doc? Dr. Hoa Nguyen. Good morning, Doc.
Good morning, guys.
Good morning.
I guess we'll just start with, so there was a meeting last night. Was there also one over the weekend?
Yes, we called an emergency over the weekend, and then on Tuesday, just because, we really have to get ready for the incoming flight from the Philippines, and that's just a big concern. So we have to make sure that everything we have is in place, so that way, if any positive come up from incoming passengers, then we had to get, be ready for the tracing team, for the clinic, and everybody. So the numbers come up very quick. I think we put initially I expect about 500-600, but now I think the number's over 1,500 by the end of the month. So that's a lot of incoming passengers. I think most of this will be return residents. And they will be quarantined at home. So that's a big job for the tracing team to make on the phone call.
Right.
At least once or twice a day to check up on the patient.
Doc, are you confident that they have the manpower and the time to be checking up on these people we're going to be putting in home ISO?
We are working on it. I know that the number will go down, and I think that we have asked the public health tracing team to really bring the number of public health worker and the tracing team to come up adequately to make sure they make the owner phone call on the tracing, because there's a lot of phone call every day to make sure people doing okay at home, make sure that people are staying home like they're supposed to. This is require a lot of effort on the community in follow up with the mandatory quarantine at home, because they start to wander around, we're going to get in trouble.
Right.
I'm sorry, what was that number you said? Over 1,000?
Yeah, it's about 1,500 plus now, so it grows double the number that we expected. So,
So Doc, this is something that we had been following, and you had told us that you advised the governor. So it looks like she took your advice. How's that feel?
Yeah, we can. It's an advice from own to physician, and the governor really listened to it. I mean, she's attended a meeting with us on Sunday because she's want to get involved. So I mean, thank you for the governor doing that, and we all have to work together really to make sure that we don't have any second wave coming in. We put some restriction there to make sure that the passengers, incoming passengers, are somewhat safe in the way on the flight to come back to Guam. So basically, we're going to require them to have PCR testing prior to boarding. It will catch everybody. It's not 100%, but at least we can weed out some to make sure that they don't come on board with the virus.
Okay, so the meeting Sunday was to discuss the return or these flights like from the Philippines, because Philippine Airlines, they announced, I think it was over the weekend, that they were going to resume their international flights on the 13th, and for Guam we're looking at twice weekly flights from Manila to Guam, or?
Yeah, I heard yesterday. I know the different numbers. Some say once or twice, but now they say 3 times. So it looked like the flight are full, because the flights, I think it's like 200 passenger flight, and it's like 190, 180. So it's a full flight. So I don't think they have any kind of alternating seat like they're supposed to. So you're gonna pack people on a small plane, and that's not the most conducive way to fly at this point. So we're really concerned, because if you have one positive on the plane, it's a nightmare to go trace everybody.
Oh my God!
On that flight.
Right, but the way it is now, if you're a returning Guam resident, you get to home quarantine. But if you're not a Guam resident, then you're still subject to mandatory quarantine at one of the government quarantine facilities, unless you have a PCR test before arriving and it's negative.
Yeah, it doesn't matter you have PCR testing or not. No, they supposed to be all negative. Everyone,
Right.
that's one of the board requirement. Even if they negative, we still need to quarantine them at home for 14 days.
Wait,
And
are we
also
talking about the returning Guam residents or visitors?
If the resident of Guam, they will be quarantined at home
Right.
for 14 days.
Mhm.
If they are non-resident, then they will be in the hotel,
For 14 days, unless they have a negative test.
Even if negative test,
They
we
still
will
have to do
be 14 days in the hotel and at home.
Okay, yeah.
Because remember
They
the
have that
negative
option.
Test, the negative test mean that you kind of okay to get on board. But remember, a negative test doesn't mean that you don't have the virus.
Right.
That
Mhm.
thing still takes 14 days.
Right,
to
quarantine
pick
is
up,
just you still have to quarantine no matter what.
Exactly.
Yeah,
Right.
that's what I was trying to say.
But
Yeah.
I think what we do is that we still have to make the phone call once or twice a day to make sure that they do okay at home or at the hotel. We still need to make sure that people stay at home and not going to work or not going to shopping anywhere, and also make sure that the family member in that family need to be aware that they are also at risk.
Right.
Because if they have elderly people in the family, or they have a lot in the family, 10, 50 people in one household, they have to be very careful about. You got to treat like every incoming passenger have the virus. That's the only way that you can prevent from getting it. So
Right.
they have to take caution at home also.
Doc, I know that this was a decision that you guys had made a few weeks ago and advised the governor of, but now that the decision's already been made, we're seeing news out of the Philippines that their COVID case count is rising. I'm looking at a story out of the Philippines here. Monday they announced 552 additional cases. So that being said, do you still stand by the decision, or do you think that we should just stick them in the hotels and that's that? I mean, obviously you don't.
The guideline we come out is really strictly is for the U.S. and the mainland to people to come in. That's return residents from the U.S. We didn't expect PALS to announce the flight so early. United right now is put on hold until further notice. But we didn't know PALS going to flight back in June. We would expect sometime in July or August. But so this caught us by some surprise, so that's why we had to kind of go back and on board. We can't change the home quarantine, but we can put some restriction there to make sure that we screen out some part of the incoming residents from, we say international flight, meaning that it's not just single out Philippines. It's everybody, Korea, Japan, Taiwan, and everything is changed every day, right? So depend on each country and how the case there is it go up, go down, or they're stable. Then we can decide per country. Right now, it's all international flight going to follow the same guideline.
So what is the guideline as a result of that meeting on Sunday?
So number one is they have to have a PCR testing at least 1 week before they boarding. Everyone to north of board, they have to have a PCR testing. And once they get to Guam, if you are a Guam resident, you go home for quarantine for 14 days. If you are non-Guam resident, then you need to go to the government's quarantine hotel to stay there for 14 days. If you are become symptomatic during that 14 days, if they have cough, cold, abdominal pain, diarrhea, or loss of taste, anything like that, then you have to go to a clinic to be seen and be tested right away. And that will be communicated to public health so they can put in place the tracing, the tracking right away as soon as you know that you're sick. So that's the current guideline at this point after the Sunday meeting.
Okay, so Friday we announced that returning Guam residents were allowed to home quarantine with or without a negative test. Sunday you guys met And we're just going to talk about returning Guam residents first. So for returning Guam residents, after Sunday's meeting, now you need a test that has to be negative from 1 week prior to arrival?
Only for international flight coming in. If you come in from the U.S., you won't need the PCR testing. We require that only for international flights.
This is for returning Guam residents.
Yes.
Okay.
For everybody, returning or
So now,
non-returning.
okay.
Everybody on the plane have to be PCR testing prior to boarding for all international flights.
But what if I'm my flight's originating in, say, Las Vegas, and then I take the route to Japan, and then from Japan to Guam?
If you show that you transit, you'll be okay. If you transit.
Mm-hmm.
If you transit to Narita to go to Guam, you'll be okay because you're considered a transit passenger.
Mm-hmm.
You're not staying in Japan for a long time.
Mm-hmm. So are we going to see a new executive order then to reflect this change that tests are now mandatory? For international flights?
Yeah, I think they're going to come out with something and they're going to add that, just modify the current guideline. You don't have to change the guideline because the bottom line is everybody's going to be 14 days quarantine, either at home or at the hotel. The only thing we add is the PCR testing for all international flights.
Right.
Yeah.
Even if you're a returning Guam resident or not?
Even you return Guam resident, because a lot of our residents are staying in the Philippines now for about 2-3 months already.
Yeah.
And they want to come home.
Mm-hmm.
So, this is a way that we create a safe way for them to come home.
Mm-hmm. But they could have came home under the announcement on Friday, though, I thought.
Yes, they can, but they have to have the PCR.
Now they have to. Okay.
That's the kicker. Because, you can't catch them all. You cannot catch everybody, but if you catch one over there, I know it's because every time you have one positive here, you have a chance to have, to spread in the community. So, every one that we catch positive and do not let go into the plane, we are one step forward.
Mm-hmm.
So,
right. Yeah, I'm not trying to be argumentative. I just want to make sure that people have the correct information when they, arrive to Guam. Was there anything else from that emergency meeting on Sunday that was discussed other than this new requirement for PCR testing?
We make sure both hospitals are ready for the surge. So we're confident that both hospitals, GMH and GRMC, can handle if they have any surge on the COVID-19 patient. And also make sure that especially the team that do the tracing and tracking, they have to be in place, and that's something that right now is in the process. I know that they will have to add quite a few more people in the team to get ready, and that's something that is a growing number and is growing every day. Right? You talk about 1,500 people coming in, but that's not the end of it. Every weeks you have 2 or 3 flights, so that number is going to keep adding up, and we have to have at least about 30, 40, 50 people on the tracing team in order to make those phone calls, unless we have a different way to track and monitor this passenger. We have several apps that public health have, but they also have some limitations. So I think every day they're still exploring new ways to try to track this one. But the most important, guys, is you need to pass out to the public is that the arriving passenger and the family we really need their help in abide by this quarantine rule, because I tell you, we don't want to go backward to call one. And I think if the cases are going up, I don't think the governor will not hesitate and put us backwards, because this is very important. It can spread out there if they not follow the quarantine guideline at this point. I'm
still not even clear on what it takes for us to go backwards to PCOR 1. It sounds very complicated. Like it would take
it's
a lot of positive cases.
Yeah, a lot of positive. It's not just positive case of
hospitalizations, right? There's different factors.
Yeah, that's the key. If you overwhelm both hospitals with the COVID-19 positive patient, and the Navy is still here, but we overwhelmed both hospitals. Man, I tell you, it's a bad sign, and it's not, and it's that would go backward, and we set July 1st as open for tourism, and that's like a big hit, and
Right.
I don't think our island can afford, our economy can afford to take a big hit like that. So we have to be very cautious of everybody and everyone. Like the mayor saying, and I know the case is 1 and 2 and very low number, but you have to practice using your mask. You have to practice using social distancing, and you have to be careful. And if you are sick, you got to go see a doctor and not go to work because you don't want to keep spreading, and the virus is still out there. You don't have to wait until the incoming passengers come in; they're still here. So you have to be very cautious about it. We don't have any people in the hospital. It doesn't mean that we're out the wood. So we're out the wood when we have the treatment or we have the vaccine, and we don't have none of those two yet.
Right, but it's also hard to tell the public we're not out of the woods when we're opening everything. So I mean, yeah, it's very, you got to kind of leverage both. I understand. Yeah.
Yeah, you have to walk that fine line. We can't stay status quo forever. This is a new norm, and we just need to make sure to practice the new norm. The our tourists, when a long time before the COVID-19, they already wear their mask already.
Right.
We kind of look at them and say, "Hey."
I know. I always look at them like, God, what's your problem? Why are you wearing a mask? Are we stinky?
I know. Yeah, but that they already had the power curve already, but now we just have to get used to it.
Yeah.
So it's uncomfortable.
I like
we
it.
have to get used to it. So, but so we want to talk about the school. So they're going to do a pilot study on the school for the summer, for the small school, the Japanese school, all that kind of stuff, and we have a team that work on that to see if it is safe, and we have some guidelines to put in, and if it works, then DOE can try to adapt the same way that they do in the small school.
Wait, so can you repeat that, Doc? You're going to be doing a study with the Japanese school?
Just a pilot study for school. There's a lot of.
Do you mean the Japanese schools in Japan or the one here?
No, not here. It's a very small class. It's like 50 people in that class, and also for the challenge kids, the special program that they need to kind of because we can't keep those challenge kids at home all the time. We really put them back a lot. So we try to open a small class, and we work with public health in those small schools to try to open up during the summer. I know DOE is not open up during the summer, but this small little class here would be in the pilot program to make sure that it's safe to send this this kid back to school with no new finding of the
Who's
case.
doing this study?
We have a group of physicians together. I think it's headed by Dr. Mike the pediatrician, and they put together a plan and present it. But we have to do this little pilot study. Remember, it's a very involved, very small subgroup of students, and we put things in place in the class. And we're going to run through it. It's monitored by most of the clinic, so we will keep a very close eye and see how we do throughout the summer.
And we're just talking about a class, or we're talking about, how many students?
So it's a small class. The class size is about, I think, less than 10 people in the class. It's very small, so it's not big. So it's not involve a large amount of people, probably less than 100 or 200 kids. So it's like I say, it's a pilot study. It's not something that involves a large scale. I know, like I say, DOE don't have anything for the summer. So this is something that they can look at and try to implement and by next school year if possible.
So have you guys prepared any kind of advice for the Department of Education on what type of reopening and measures? Have you been part of that conversation?
I think they're going to try to meet with the DOE and present their plan. Like I said, all we try to do as advisory board is try to get somewhat the new norm for everybody. So we got to take this little step here throughout the summer, because I know all the kids want to go back to school, and this is not.
Wait, what did you say?
Yeah.
All the kids want to go back to school?
You know,
I gotta fact check that, Doc. Gotta fact check that. First of all, where'd you get your information?
How many are these kids going to be tested first? How does this study work?
They're not going to be tested first. You know, kids is unique way. You know, they mostly it's not easy for the kid to pass the virus to the adult. It's easy for them to catch them. So you know, there's a lot of guidelines that Dr. Mike Uman and the rest of the physicians have come up with. You know, and they do a lot of research, look at a lot of stuff in the states and in different countries, and they just try to implement just a small program, right? Just like I said, they call it a pilot study. So it's going to be very closely monitored by all the physicians to make sure that they run well. They even go to the school and then do the inspection and meet the school that's open. So it's very well run thing, and hopefully they do well. And I say they're going to work with DOE and try to help them. You know, we're not going to tell you what to do. Just we're going to give some recommendation. You know, because remember, this is all about the healthcare system. So we're going to try to help everyone.
And this is voluntary, right?
Yeah, it is voluntary.
Okay.
I mean, the school has their own guidelines. So they meet the field school. They're really strict in the guidelines. No, so it's very good. I mean that, you know, our guidelines is a basic, and they can implement anything above that to protect the kid and the parents, the teacher, and that stuff. So there's a lot of stuff we try to do. Again, we got to go through the summer. It's a new norm, so we have to kind of move forward. Unless we have a big spike, and hopefully we won't.
We don't.
How old are the kids?
This probably ninth grade to below. I think this is a special. A lot of them is for the special kids, you know, special students. So a lot of like I say, there's a language for a lot of the students. So I think the Japanese school they want to open. You know, it's very small. They think like 50, 60 people on it.
Right.
It's not too big. So we just make sure that when they open, that they're safe and they're monitored by the physician.
Right on. Yeah. Keep us posted on that, Doc. That sounds interesting.
And
Yeah,
also,
I mean, you know, anything else, you know, we'll keep you posted, and anything else, you know, I ask them to talk to you.
And also, in your physicians advisory group meetings, have you guys had any discussions on businesses that have since reopened under PCOR 2 that have been violating any of the guidelines? And are they going to be held accountable? Or how are they even going to be held accountable?
Every business is open. You know, they submit some type of guideline to the Chamber of Commerce and to Public Health, and they've been reviewed to approve it. So, you know, I think that we don't have any manpower to go out there and make sure everyone follow the guideline. But again, you know, every business do want to open, and they don't want to, you know, find out that they break something because it's a case in that business. You know, because now doesn't mean they're going to shut the business down. So I think every business will take great responsibility and try to follow the guideline put forward to public health by the industry. So no one want to get shut down. I tell you, people want to open, and they're going to take all the precautions to try to protect the customer and their employee.
But if nobody's enforcing anything, anybody just sounds like can just open.
Yeah, I don't think not people go around and inspect them. It's a customer responsibility too. When you go to a restaurant, you go to a business, and you see this don't look right. You know, you go to your beauty shop, and you don't look right. You know, I think it's the responsibility of every customer to report it.
Right.
You know,
Report it to public health?
To public health or to anybody that's supposed to enforce this thing. But I think that's the way that we have to trust our business and go forward. Because I tell you, you can't go police every business, make sure they follow. But like I say, so far from what I see, when every business it's not like it's picked up 100%. People are still very cautious, and
Right.
you know they don't go to a restaurant to eat. You know, not that many. So and the restaurant owners, so they really want to practice very good precaution on all the customers. So I think we do okay, guys. I think let the business do their own stuff.
Right on, Doc. Well, thank you for your time, Doc. Definitely appreciate all the insight that you provide from the Physicians Advisory Group.
Yeah, was there anything else though that was discussed?
No, that's it. That's it, Sabrina. We basically just want to move this whole island forward.
Okay, so Dr. Cruz didn't give anything on the Tier 2 clinics?
No, there's no Tier 2 clinic. You know, guys, we, no, it's kind of a conflict interest for the Tier 2 and discussing that. You know,
Okay.
we just put that in the AG office and let them run it. But,
Okay, so it's
you know,
still there.
if I'm the chair of the advisory board,
You never like kick Dr. Cruz under the table or anything, Dr. Nguyen? Like, hey man, what the hell, dude?
No, we work together. I mean, he's under a lot of tremendous responsibility and stress, and he a lot on his shoulders. So we work together. And,
Right on.
You know, so he's very good.
Okay. Well, thanks.
Real quick, public health emergency. Are we still looking at June 30th? It expires. We've got the announcement about international flights, Philippine Airlines. Are we looking at another possibility of it being extended?
I don't know. I think right now to June 30th, right? Yeah, really depend on this incoming flight. I think everything right now, I feel
Just
like
wait and see.
just put our heads and you know, like I said, even in my clinic, we trying to come back somewhat normal, but I put everything on hold now just because we don't want to change so much and let our guard down. So yeah, it's just really depending on this incoming flight and see how we do by the end of June.
All right.
All right, Doc.
Thanks, Doc.
Thank you. Wash your hands.
Okay, thank you guys. Have a good day.
Right.
You too.
Bye-bye.
Let's keep it on the phones here and go over to the kind of switch gears a little bit and bring on Art Paris from the Guam Power Authority. Good morning, Art.
Half a day, Chris. Half a day, Bree.
Hi, Art.